6. Treatment of lung cancer. 1. Radiation therapy. Radiation therapy uses high-powered energy beams from sources such as X-rays and protons to kill cancer cells. During radiation therapy, you lie on a table while a machine moves around you, directing radiation to precise points on your body. For people with locally advanced lung cancer, radiation may be used before surgery or after surgery. It's often combined with chemotherapy treatments. If surgery isn't an option, combined chemotherapy and radiation therapy may be your primary treatment. For advanced lung cancers and those that have spread to other areas of the body, radiation therapy may help relieve symptoms, such as pain. When compared with standard radiation therapy techniques, newer and precisely targeted treatments may be more effective and cause fewer side effects. Mayo Clinic offers cutting-edge radiation planning and treatment technologies, including intensity-modulated radiation therapy, volumetric modulated arc therapy, image-guided radiation therapy and proton therapy. 2. Chemotherapy. Chemotherapy uses drugs to kill cancer cells. One or more chemotherapy drugs may be given through a vein in your arm, intravenously, or taken orally. A combination of drugs usually is given in a series of treatments over a period of weeks or months, with breaks in between so that you can recover. Chemotherapy is often used after surgery to kill any cancer cells that may remain. It can be used alone or combined with radiation therapy. Chemotherapy may also be used before surgery to shrink cancers and make them easier to remove. In people with advanced lung cancer, chemotherapy can be used to relieve pain and other symptoms. 3. Radiosurgery. Stereotactic body radiotherapy, also known as radiosurgery, is an intense radiation treatment that aims many beams of radiation from many angles at the cancer. Stereotactic body radiotherapy treatment is typically completed in one or a few treatments. Radiosurgery may be an option for people with small lung cancers who can't undergo surgery. It may also be used to treat lung cancer that spreads to other parts of the body, including the brain. 4. Targeted drug therapy. Targeted drug treatments focus on specific abnormalities present within cancer cells. By blocking these abnormalities, targeted drug treatments can cause cancer cells to die. Many targeted therapy drugs are used to treat lung cancer, though most are reserved for people with advanced or recurrent cancer. Some targeted therapies only work in people whose cancer cells have certain genetic mutations. Your cancer cells may be tested in a laboratory to see if these drugs might help you. 5. Immunotherapy. Immunotherapy uses your immune system to fight cancer. Your body's disease-fighting immune system may not attack your cancer because the cancer cells produce proteins that blind the immune system cells. Immunotherapy works by interfering with that process. Immunotherapy treatments are generally reserved for people with advanced lung cancer. Mayo Clinic researchers made an important discovery that led to immunotherapy treatments called immune checkpoint inhibitors that have revolutionized care for people with metastatic lung cancer. 6. Palliative care. People with lung cancer often experience signs and symptoms of the cancer, as well as side effects of treatment. Supportive care, also known as palliative care, is a specialty area of medicine that involves working with a doctor to minimize your signs and symptoms. Your doctor may recommend that you meet with a palliative care team soon after your diagnosis to ensure that you're comfortable during and after your cancer treatment. In one study, people with advanced non-small cell lung cancer who began receiving supportive care soon after their diagnosis lived longer than those who continued with treatments, such as chemotherapy and radiation. Those receiving supportive care reported improved mood and quality of life. They survived, on average, almost 3 months longer than did those receiving standard care.